That is a great question. You're not a colorectal cancer patient, but in lung cancer, we have studies that have actually shown that lung cancer patients also benefit from exercise. And this is one of such studies. Now, what the study was looking at was specifically in patients who were going to undergo surgery. And what they did was they looked back at patient, like two groups, two cohorts of patients. That's a group of patients where we tried to optimize them from the medical standpoint for surgery, try to correct some of their baseline issues with their blood numbers, like the anemia, and also have them stop smoking. So that was one group. The other group did the same thing, but in addition to that, they added exercise, nutrition, and some psychosocial support. This was something called, we call multimodal prehabilitation. Just think about it as preparing for the marathon, which is the surgery in this case, but really doing all of this work to prepare for that main event. And what they saw was that with the addition of things like exercise, optimizing nutrition, psychosocial support, a couple of things were better in the lung cancer patients. One thing was overall the rate of complications in the group that received this exercise and nutrition optimization was a lot less. So about 46.3% compared to 65.3% in the other group. In terms of ICU admission, interestingly, those who did the exercises ahead of time, ahead of the surgery, also were less likely to be in the ICU, admitted in the ICU. Another metric that is very important to us is about readmission. So that is after surgery, did this patient have to be readmitted into the hospital? What we found is that with the addition of exercise, nutrition, optimization, and psychosocial support prior to the surgery, the rate of readmission was lower, and the days alive at home after surgery was also higher. So, what we gather from that study was that, hey, exercise before surgery provides benefit, and that's a good thing.